Hello, this is Beverly Watson from the Laureate Studios. We are so excited to welcome Dr. Kathleen Ruddy of the Breast Health and Healing. Thank you so much for joining us, Dr.
Thank you
Ruddy.
for having me. Thank you.
You talked to me a little bit before about some of your inspirational work with cancer prevention. Can you tell us a little bit why you're here at CGI this year?
Well, I am a surgeon. My specialty is breast cancer.
Mm-hmm.
I have 6,000 patients in my practice. And 7 years ago, they convinced me of something that I knew all along, which is that we have to understand what's causing this disease and prevent it. I am particularly interested in the breast cancer virus, which looks like it's responsible for a large portion of breast cancer, and the preventive breast cancer vaccine that was developed at the Cleveland Clinic 3 years ago. So what better place to share this than at CGI?
That's amazing work. The breast cancer preventive vaccine that was created 3 years ago.
Yes.
And part of what you want to do is to fast track it?
I would like to. I think that the vaccine has shown itself to be highly effective in preventing breast cancer in 3 animal models. It normally takes 5 years to complete a phase 1 study to see whether or not a new drug or vaccine is safe for use in women. And I think given the global burden of breast cancer, I think we can make the arithmetic argument to fast track the vaccine.
Well, you shared with me a little bit of your personal story about something that happened with your mom and where you were in your studies. Could you share a little bit about that to the students? Because I thought that was amazing and perhaps inspirational as you had that personal story that led you to study more and to really be where you are today.
Well, my mother was diagnosed with breast cancer in 1974. I was the secretary at the time. And fortunately, she's still alive. But it informed my career decision to actually pursue my studies, first as a medical secretary, and then as a physician assistant, then as a medical student, a surgeon, and as a breast cancer fellow at Memorial Sloan Kettering. What I would say to students, really, is to find something that you love and do it.
Yes.
Do it well. Let the world know that you're doing it. And the world will come to you. And when they come to you, you should ask how you can help. So that's the message that I would just like to share with them.
I love it. I love it. And as we watch the work in healthcare, we literally have students from around the world who are watching. We have over 23 countries who are here. And the work that you're doing with breast cancer, I'm sure, has a global effect as well. And so is there a way that they can participate or they can understand or follow up afterwards?
Well, what I would ask them to do is, first of all, to understand that breast cancer is the most common female malignancy in every country in the world. So everybody has a dog in the fight. The world cannot afford to continue to be preoccupied with diagnosis and treatment, as important as that is for the women with breast cancer. But the majority of women don't have breast cancer and don't want it. And the world can't afford to continue to support the burden of this disease if we can prevent it. So what I would say to the students of the world is, again, find something that you love, but if you have a minute, perhaps you could take this message and make it viral.
Love it, love it. Thank you so much. The last question in closing would be, again, just your leadership in this, and we actually had Sheryl Sandberg this morning, the author of Lean In, speak with us. You as a woman in leadership in the medical field, do you have any thoughts for our students on how they can leadership? What does leadership look like? Or
well, I'll tell you what leadership looks like to me, and that is for me to do the best job that I can. And to really invite others to tell me their stories, because it's other people's stories that really inform my work. So I'll give you like a 10-second example. Last night I was at the topic dinner that Exxon hosted, and I stood next to a man from Kenya whose mother was a single mother, and he lost her at the age of 15. There was no money for school fees. He managed to learn to read. He read a book about Martin Luther King. He was able to catapult himself over this chasm into college here in the United States. And he's now back in Kenya emancipating women.
Wow.
Now, his name is Kennedy. His name is Kennedy Odidi. So to listen to the story, it's a very interesting story, but there's a jewel in the crown there, and that is that his mother named him Kennedy. So it's that kind of, I guess, quality of leadership.
Yes.
That I think is the most important aspect. Listen to people's stories and really pay attention to what they're telling you, because it can inform your work.
Thank you so much, Dr. Ruddy. How inspirational. I really appreciate you sharing your time with us this morning
Thank
in the
you.
Laureate Studios.